Thank you for tuning in today, and thank you, Saren. I'm Alva Ferdinand, and I'll be talking in the next few moments about rural healthy people and the processes that we use to conduct this process to gather leading health indicators. And I'd like to just sort of walk us through how rural healthy people came to be a thing in the first place. So the first principal investigator of rural healthy people was Dr. Larry Gamm, and he's professor emeritus right now, but was a political scientist in our department. And he really loved to merge the ivory tower with the real world. And so he conceptualized this idea of rural healthy people and collaborated with the Southwest Rural Health Research Center, which was then led by Dr. Catherine Hawes. And also on the team at the time was a brand new assistant professor named Dr. Jane Boland, who many of you may recognize and know. And also on the team was Dr. Gail Bellamy, who was at Texas A&M, but then transitioned to Florida State University, but continued to work on this project. And several other Texas A&M faculty, staff, and graduate students worked on this as well. The work was commissioned by the Office of Rural Health Policy, which we now know to be the Federal Office of Rural Health Policy, in 2002. And the big idea was sort of to make rural healthy people be a companion to healthy people, which Saren just talked about. And so the idea was this would be sort of a companion document to sort of say, yes, we know what the objectives are at the national level, but what things are really critical for rural America. And that sort of made it so that we had to talk to stakeholders in rural America to sort of see what are those priorities that really float to the top in their minds. And so the idea was to take those priorities, merge it with models for practice that were in use, but perhaps not really well known, and put those things in one central location so that those that are interested in rural population health could have access to it. And so what resulted from that work were 3 volumes, 2 of which are on the Rural Health Research Gateway. Mark mentioned that resource earlier. But if you want to take a look at those are still on the website. And depending on the size screen that you have, you may or may not be able to see this, but it's sort of just a example of the table of contents in those volumes. And I can circle back to this as we continue, because what you'll discover is that the content of the volumes closely matches what is identified by rural stakeholders as being priority. So in 2010, well, in 2002, I should say, based on Healthy People 2010, these were the priorities that emerged as being the top 15, or those that are ranked in the top 15. And you'll notice that there are quite a few issues that were tied. And so what Dr. Gamm, Dr. Boland, Dr. Bellamy, and others did, they convened 4 focus groups of state and local rural health leaders and said, how would you rank these? What are the top priorities and how would you rank them? And what you'll notice is that ranked 1 was access to quality healthcare. And the list went on with diabetes, oral health, substance abuse, and that kind of thing. And I'll show you how some of these changed over time. So let's fast forward to Healthy People 2020. That was disseminated in 2010. And Dr. Boland was now leading the ship in this effort. And it was sort of the same idea. We need to talk to rural stakeholders to figure out which objectives from Healthy People 2020 are the ones that we need to focus on really to move the needle in rural population health. And she went about it in a slightly different way. Dr. Gamm really liked talking to people and doing focus groups. Dr. Boland instead convened an advisory board that included representation from various funders, rural health providers, critical access hospitals, and rural health agencies at the state and local level and national levels. And they developed a survey that was nationally disseminated to sort of get a bit more input than what was received in the 2010 iteration. And so again, the idea was to sort of identify those priorities, but also to talk to actual boots on the ground, people who are actually doing the work, to get an idea of what kinds of models were being implemented, what programs were being implemented and envisioned, and which programs showed a lot of promise and which ones were already deemed to be effective. So the information then, we didn't want to keep it to ourselves, but needed to be disseminated at local, state, and federal level. So just to give you a sense of how this rolled out, in December of 2010, the survey was disseminated. 755 people responded. Dr. Bolin wasn't quite satisfied with that number, so it was again pitched out in the spring of 2012. And that was sort of following a webinar that Dr. Bolin did in conjunction with the National Organization of State Offices of Rural Health, and targeted letters that were sent to state health officers. And what they ended up with was an N of 1,214 respondents. These next couple slides just give you an idea of where those respondents came from. The idea, again, was for this to be nationally representative, and we see Ohio, Texas, and Missouri really led the way in terms of input. We didn't quite get any responses from Nevada, so we're hoping that in our next iteration, Rural Healthy People 2030, we can get respondents from each of the 50 states. So just to give you a sense of who these people were, right? Who are these stakeholders? And I'm sure that many of you in the audience today would be considered our stakeholders as well. There's a good percentage who were healthcare providers in critical access hospitals, critical access hospital administrators and other rural health clinic administrators, educators, those who were really focused on preparing the workforce for rural and underserved work, as well as researchers and other kinds of individuals. So what we'll see here is in 2020, access to quality healthcare services again popped up as the leading priority. And they're all listed for you here. The first 10 being on your left, and priorities 11 to 20 on your right. And again, sort of, we saw chronic diseases really popping up as leading health indicators as far as rural health stakeholders were concerned. This slide just sort of gives you a sense of which indicators remained at their rank from the previous iteration in 2010, which ones moved up and which ones moved down. And we will again try to keep track of this in 2030 when we roll that out. Notably, nutrition and weight status moved up in the ranking, and that perhaps shouldn't be surprising given our focus on obesity over the last decade or so. So many of you may have seen these, many of you may have them on your shelves, but they're also available online, volumes 1 and 2 of Rural Healthy People 2020. And again, the idea is to really merge the ivory tower with people on the ground, boots on the ground, people who are actually seeing the discrepancies and the limited resources unfold in real time. And the goal was to write these chapters on each of these topics, sort of telling people where the data come from, was it national in scope, was it local in scope, and what are some of those innovative things that rural populations are doing to meet those needs. So we sort of kept track on the website on who was downloading the volumes and what they were using it for. And these aren't mutually exclusive, but we saw things like, we're using it for proposal development to get resources into our rural communities. We're using it for health services planning. We're using it for advocacy, lobbying, agency training, and that kind of thing. And so we hope to continue this tradition at Texas A&M. We're huge on traditions of making these resources available so that both researchers and people who are in these agencies can use it to the best of their ability for leveraging improvements in population health. These are just some representations of the entities that have downloaded Healthy People 2020. And again, we're seeing a nice mix of researchers, but also hospitals, nonprofit organizations. We mailed about 2,500 volumes across the country to governors, to different policymakers, to AHECs, rural health clinics. And we know that this information has been used to really highlight the need in rural America. So what didn't change between 2010 and 2020 was this really keen awareness that access to care is a top priority. We've talked a bit this morning about rural hospital closures and some of the other challenges with seeking care in rural America. And that perhaps is going to be even more highlighted now that we are in the midst of a pandemic going into Healthy People 2030. What also popped up was this idea that we really need to highlight more targeted prevention and care models. And we really need to make those models available to a wider net of people. So I'm looking forward to Healthy People 2030 and Rural Healthy People 2030. The idea is going to be the same. I looked this morning to see if Healthy People 2030 is available to us, and it is not just yet. We know that there's been some delay with that due to COVID-19, but the idea is again going to be to merge researchers with practitioners so that we can identify those areas for which really targeted attention is needed. But one of the things that we're going to do for 2030 is really focus on data sources and which data sources needed. And we're going to just continue to keep rural health on the forefront of policymakers' minds at the state, local, and federal levels. So here's my contact information. And we'd love to have you participate, love to have you help us in this endeavor. Thank you very much.